and strongly believe that without his leadership, we would not be where we are today in our effort to reform health care in this country. So I congratulate him on the superb effort he's made. Mr. President, I want to spend a few minutes talking about health care reform, that both as it affects the country, but also as it affects my home state of New Mexico. First, I'd like to discuss the context for this health bill, and that is the very serious problem that we face as a country with growing cost of health care if the Congress fails to act. Now, we have a chart that I'll put up since everyone's got charts. This is a chart that shows what's happening to all health care costs and has been happening since 1960. And you can see that as a percent of the gross domestic product, back in 1960, we were spending right at 5% of our gross domestic product on all health care in this country. Today, we are spending much more like 16% of the gross domestic product on health care. And the projections for the future, if we do not act to reform the health care system, the projections for the future are very serious indeed. Let me allude to an article that was in the morning New York Times. This is by award-winning, the Nobel Award-winning economist Paul Krugman at Princeton University. And he talks about this issue of fiscal responsibility and the impact of health care reform on the deficit, and talks about how some senators seem to believe that they have concerns about going ahead with this health care reform bill because of what it might cost. And he makes the point, he says, if they're really concerned with fiscal responsibility, they should not be worried about what would happen if health reform passes. They should instead be worried about what would happen if it does not pass. For America can't get control of its budget without controlling health care costs, and this is our last best chance to deal with these costs in a rational way. Mr. President, I'd ask that his full column from the New York Times this morning be included in the record following my remarks.
Without objection.
I think as this chart demonstrates, the one here on my left, according to the Congressional Budget Office, if we don't act to deal with the growth in health care costs, federal spending on Medicare and Medicaid combined will grow from 5% of GDP today to almost 10% by 2035. By 2080, the government would be spending almost as much as a share of the economy on just its two major health care programs as it has spent on all of its programs and services in recent years. Let me put up another chart that demonstrates that most of this increase in cost is not the result of our aging population. We do have an aging population, and that does add to the cost of health care, because as people get older, they tend to need more health care. But what this chart shows is the dark blue here shows the increase that is expected in costs, health care costs, by virtue of aging, but the lighter blue talks about the effect of excess cost growth, and that is not related to aging. That is just that the growth in health care costs are out of control in our current system. Such spending is unsustainable. It has led the Congressional Budget Office to say that slowing the growth rate of outlays for Medicare and Medicaid is the central long-term challenge for fiscal policy. Moreover, across the country, premiums continue to increase. They're becoming more and more unaffordable for individuals and for businesses. I hear on a regular basis as I go around New Mexico, and I'm sure all my colleagues hear from their constituents as they travel in their states, that people cannot continue to pay more and more each year for their health care coverage. According to an August report by the Commonwealth Fund, nationally, family premiums for employer-sponsored health insurance increased 119% between 1999 and 2008. And if cost growth continues on its current course, those premiums could increase another 94% to an average of $23,842 per family by 2020. Now, I'm not sure what the circumstance is in many states, but I know in the state of New Mexico there are many families who cannot afford to be paying $23,800 in health care premiums. Nowhere is the unsustainable growth felt more acutely than in my home state. Without health reform in my state, these are the projections, we are expected to experience the greatest increase in health insurance premiums of any state in the Union. For example, the average employer-sponsored insurance premium for a family in New Mexico was about $6,000 in the year 2000. By 2006, this rate had almost doubled, or the cost had almost doubled to $11,000. By 2016, the amount is expected to rise to an astonishing $28,000. In addition, health insurance premiums in New Mexico make up a larger percentage of New Mexico's income, the income of the average New Mexico family, than almost all other states. We are paying 31.18%, over 31% of the average income of a family in New Mexico is going to pay for health care. This is expected to grow to 56% if we do not reform our health care system. It's important to highlight that the higher spending on health care in the United States does not necessarily prolong lives. I mean, I hear a lot of speeches around here about how we have the greatest health care system in the world. We're the envy of the world, and people would just love to have access to our health care system. This chart illustrates that in 2000, the United States spent more on health care than any other country in the world, an average of $4,500 per person. That was in 2000. Switzerland was the second highest at $3,300, substantially less. Essentially in Switzerland, the cost per person was 71% of what it was in the United States during that year. Nevertheless, the average U.S. life expectancy comes out at 27th in the world. Our life expectancy average is 77 years. Many countries, 26 to be exact, achieve higher life expectancy rates with significantly lower spending on health care. Data from the McKinsey Global Institute clearly indicates that there is a considerable level of waste in our current system. McKinsey estimates that the United States spends nearly $500 billion annually in excess of other similarly situated nations. Of this, about $224 billion in excess costs are found in hospital care. About $178 billion are found in outpatient care. Together, these account for more than 80% of U.S. spending above the levels of other nations. Here's one other chart. This is one that I've used before here on the Senate floor. Not surprisingly, as costs and inefficiencies continue to build, access to health care is becoming more and more difficult for middle and lower income Americans. This chart indicates the rate of uninsurance throughout the country. First, on the left-hand side, this is in the year 2000. On the right-hand side, the year is 2008. And you can see the dark colored, the dark blue states are states where 23% or more of the population aged 18 to 64 are uninsured. Back in the year 2000, New Mexico and Texas were the only two states where the rate of uninsurance exceeded 23%. Now you can see that the rate of uninsurance exceeds 23% for many of the states, particularly across the southern part of our country. We have a very serious problem that needs addressing. It's clear that the U.S. healthcare system is failing many Americans, and the situation is becoming more and more urgent. According to a study published by the Harvard Medical School in August, medical costs have led to almost two-thirds of the bankruptcies in this country. More than 62% of the bankruptcies are attributable to healthcare problems. The study found that most medical debtors were well-educated in their own homes, had middle-class occupations, and shockingly, three-quarters had health insurance. So these were people who had coverage, but the coverage was not adequate to meet the needs. Unfortunately, for many individuals, the very high cost of medical care leads them to delay or to avoid receiving medical care altogether. The Urban Institute reports that 137,000 people in this country died between 2000 and 2006 because they lacked health insurance. That includes 22,000 people in the year 2006. So clearly the need for national health reform has never been so great. The Patient Protection and Affordable Care Act, which is the legislation we are debating here on the floor, which was introduced by Senator Reid and others a few weeks ago, it includes the key reforms that we have come up with and that the experts have come up with that are aimed at addressing these very serious problems while protecting the aspects of our health system that are working today. First, this bill includes long overdue reforms to increase the efficiency and the quality of the healthcare system while reducing overall costs. For example, the legislation includes payment reforms that I've championed to shift from a fee-for-service payment system to a bundle payment system. This will reshape our healthcare reimbursement system to reward better care and not simply more care, as it currently does today. Second, it includes a broad new framework to ensure that all Americans have access to quality and affordable health care. This includes the creation of a new health insurance exchange in each state, which will provide Americans a centralized source of meaningful private insurance, as well refundable tax credits to ensure that coverage is affordable. And finally, these new health insurance exchanges will help improve choices by allowing families and businesses to compare insurance plans on the basis of price and performance. This puts families, rather than the insurance companies or the government bureaucrats in charge of health care, helps people to decide which quality, affordable insurance option is right for them. The Congressional Budget Office, which is cited here, and I think it's healthy, quite frankly. I noticed that the Congressional Budget Office is cited by both the Democrats and the Republicans in this debate. That is a credit to the Congressional Budget Office. They are seen as nonpartisan. They are nonpartisan. And I congratulate Doug Elmendorf for the good work that the CBO has been doing in support of our efforts to come to the right answer on health care reform. But the CBO forecasts that this legislation would not add to the deficit. As the chart that Senator Baucus had up here just a few minutes ago clearly indicates, the deficit would be reduced in the first 10 years by $130 billion. It would be reduced in the second 10 years, going up to 2029, by something over $600 billion. Let me just also point out the contrast here. We're talking here about a bill which the Congressional Budget Office says will reduce the size of the deficit in future decades. I can remember a couple of Congresses ago when we had a debate here on adding Subpart D to Medicare, Part D to Medicare, and there were many on the floor here who are concerned about cost today, at least they say so in their speeches, who were very anxious to add that legislation to Medicare, adding another $500 billion, that was estimated by the CBO at that time, another $500 billion over a 10-year period to the cost that Medicare was bearing. The efforts we're making in this legislation to bring under control the cost growth in Medicare is essential if we're going to keep Medicare solvent in the future and part of the solvency problem Medicare has in the future, frankly, is related to what we did in Subpart D. Mr. President, I see my time is up, and there are others waiting to speak. Let me just conclude and ask unanimous consent that the balance of my statement be included in the record.
Without objection. Senator from Montana.
Mr. President, how much time remains under the control of the majority?